Thank you again to Sally, Lori, and Jody for your courage and your strength in sharing your stories with us here today. Let's give them another huge round of applause. Our next presenter is Dr. Christine Miller, pharmacologist. And let's join in a round of applause to welcome Dr. Miller here to the stage.
Good morning. Yes, I'd like to point out that I'm also the director of Smart Approaches to Marijuana in Maryland, where I volunteer my time. My area of expertise is predominantly the molecular neuroscience of psychotic disorders, including schizophrenia. And I've devoted about 25 years to researching the cause, both in the private sector and in the academic setting. What I hope to accomplish in following the presentation of Shane's, Andy's, and Jared's story is to show you the science that will back up their experiences and their tragic outcome. The crux of my talk will focus on the scientific literature that really demonstrates a causal association between marijuana use and the development of schizophrenia. Next, I'll move on to a subset of neuropsychological traits that are engendered by marijuana use that I think may have some bearing on some increases in crime that have been seen. But first, what I want to show you is the data on how marijuana laws make a difference to use of this drug. I feel that too many who have a podium, including, unfortunately, many health sciences professionals, will speak on this topic without actually having researched the data that's out there. So from Europe, we've known for several years there have been studies conducted by an organization known as SBAD, where every 4 years they track the use of 15 to 16-year-olds, the past month use of marijuana. And in Europe, there's a spectrum of different laws on this drug. So the Netherlands, Czechoslovakia, Spain, and Italy have either outright legalization or de facto legalization of this drug. For example, in Italy, they don't confiscate it. It's ostensibly decriminalized, but they don't even take it away. There's no penalty whatsoever. So that's really de facto legalization. Those countries have a 3-fold higher rate of teen use in age 15 to 16-year-olds than the countries where it has remained illegal. That's a huge difference. And to give you a point of reference, if you compare Norway, which is a Scandinavian country, and many people think of Scandinavia as being very avant-garde, pushing the social envelope. Actually, they do believe in social engineering, and part of that is laws. And so it has remained illegal there. They have a lot of drug education, and their rate of use is 2% versus 20% in the Netherlands. That's a huge spread. The decriminalized countries lie in between. Now, within our own country, we have the experience with decriminalization of marijuana. And if you look at states that have strict decriminalization codes, so by that I mean states that increase their penalties for repeat offenders who require drug education, drug counseling, maybe even drug testing. And in some states, if marijuana is apprehended in the passenger compartment of an automobile, their penalty reverts to a criminal offense. In those states, this is CDC data for students grades 9 through 12. The rates, and this is collected every 2 years, the rates of monthly use by students are significantly lower in the states with strict decriminalization codes than in the states with lenient codes. A perfect example of this is Massachusetts. Now, the CDC began collecting data on marijuana use rates in the 1990s. That was actually after many states decriminalized. Amazingly enough, I didn't know this till I got into the subject. And then also, recently there's been a rash of decriminalization, too recent to have good and before and after data. But Massachusetts falls in the perfect window of time. They have a very lenient decriminalization code. It's a $100 fine, not even like a traffic ticket because there are no points. You know, so basically there's no drug education, nothing. They just say goodbye. In that state, when they decriminalized in 2008, the youth use not only went up significantly, and this again is CDC data, but it reversed what had been a downward trend. So that's really a significant change when you see that kind of reversal. Next, we have this grand experiment in Colorado. And what you can see, this is a different data set. This is something that has begun to be collected more recently by their NSDUH reports. They're collected yearly. And what you can see in Colorado is that use by 18 years and older rose dramatically after legalization in 2013, and also reversed what had been a downward trend. Looking at the other age groups, a more narrow window, 18 to 25, similar pattern. The age 12 to 17 is interesting because their use began to tick up in 2012, which is the year that the voters voted to bring it in. And it's known from many studies of youth behavior, when perception of risk goes down, the use of this drug goes up. So undoubtedly, the massive push to legalize, all the press, you know, influenced this particularly vulnerable age group, and they began their rise in 2012. Now, why does this matter? Well, it matters to me because, as you heard earlier, it triggers the disease that I study. You may think that, well, maybe this is a rare outcome. Actually, the data show that for low to moderate strength marijuana, 12 to 15% will experience isolated psychotic symptoms. So that means things like paranoia, hearing voices, racing thoughts, delusions of grandeur. But they'll be isolated, they won't be a constellation of symptoms, and they're usually reversible, except for those who continue. About 35% who have any kind of prodromal symptoms like this can be expected to convert to full psychosis, which means you have all the symptoms at once, you know, much more serious condition. And of those, about half will convert to chronic schizophrenia, which is generally a lifelong disorder. These are this last point is very large studies out of Europe. Thousands of patients have been studied. That's for the low strength pot, which increases the risk for schizophrenia about 2 to 2.5 times. It's a very expensive illness, you know, and also very tragic. And unfortunately, the high strength pot increases the risk. These are studies out of Britain, 5-fold. So imagine, you know, the added economic burden, you know, if you forget the human tragedy that this would entail for our country. Now, the pro-marijuana advocates love to bring up the point that correlation does not equal causation. This is kind of getting to be a tired phrase, especially when you consider that the tobacco companies used to use that logic when talking about tobacco and lung cancer. And so my response to this is, you know, there are now hundreds of studies showing a correlation between marijuana use and psychosis. And if you look within those studies, you can find studies that address the issue of causation. Front and center is a dose-response correlation. That's essentially Pharmacology 101. If you're looking at a causal mechanism, you darn well better see a dose response, and you see that with marijuana. The more potent the product, the more frequently it's used, the more likely an outcome of schizophrenia and other psychotic disorders. Then the timing, this is very simple to understand. The marijuana use generally precedes a psychosis, not vice versa. These are prospective studies where they've followed thousands of teens in Europe, and they've seen that, you know, generally this is the pattern. You know, at the time, the marijuana use comes first. Individuals with schizophrenia who are marijuana users have an earlier age of onset. So this is similar to carcinogens making people get cancer earlier in life for a suite of cancers. Marijuana does that for schizophrenia. The purified ingredient from marijuana, delta-9-THC, when administered in controlled clinical situations and under the monitoring of psychiatrists, will induce psychotic symptoms. 4 different studies have shown that. And then this is actually one of the most convincing to me, a huge study out of Finland where they followed, they can do this in those countries because they have centralized health care. They followed nearly 19,000 patients who had some form of drug-induced psychosis. And then they did hospital discharge records over about a 16-year period. Then they followed each patient for an additional 8 to 10 years. And what they found is that of all the drugs, it was marijuana that most consistently resulted in conversion to chronic long-term schizophrenia, about half the time, as I mentioned before. Not LSD, PCP, cocaine, methamphetamine, opiates. Alcohol was at the bottom of the list. And basically showing that, amphetamine was the next most likely drug, and it resulted in conversion at about a quarter of the time. So this shows you the myth that, marijuana has to be laced with something else in order to cause psychosis. Actually the reverse is true. Lace these other drugs with marijuana, and you're more likely to end up schizophrenic. And finally, the marijuana advocates like to bring up the issue of self-medication. These people who are psychotic are just using marijuana to make themselves feel better. And actually, the data show, this is a study out of New Zealand, show that people who experience psychotic symptoms, especially the paranoia, are more often likely to try to quit because it's so unpleasant. In fact, an example of that is comedian Seth MacFarlane, who quit in a very public way. He announced, he'd been using for years, he said, but all of a sudden he was getting extremely paranoid and he quit. So, I think that argues strongly against the idea that there is self-medication going on. Now, every now and then, conflicting data is published, as happens in science. Generally, there's small studies showing that, there's no link between marijuana use and psychosis. This was a particularly unfortunate one that came out this summer because it garnered so many headlines. However, if you look at the data, which I did online, it's available. Their original data was available in supplemental files. What you could see is that the incidence of psychosis was actually 3 times higher in the marijuana users. So what happened? It turned out that when they corrected for other factors, the effect of the marijuana completely disappeared. Now this raises a red flag because you don't usually see that when you apply correction factors. So I looked more closely at the correction factors they applied, and they included socioeconomic status, the current socioeconomic status of the user, and also whether or not they had health insurance. The first thing that happens to someone with schizophrenia is they fall way down the socioeconomic ladder. And then they're also more likely to be dropped from health insurance policies. So these authors were applying these factors as if they were potentially causal, and they completely overpowered the marijuana effect. They have been encouraged to publish an erratum and actually have agreed to do so. Now, you might ask whether just those with a family history of psychosis are at risk. You heard earlier, Shane's story, he had no family history of psychosis. And my hunch is that when all the genetic studies are done, actually it will prove not to be the case. I mean, certainly, those who have a family history of psychosis might be more at risk, but I don't think it's limited to that group. And anyway, it's really a moot point, because about 10% of the population has a family history, whether they know it or not. And that's a lot of people to put at risk. Even if you have heavy genetic loading, however, even if you have an identical twin with schizophrenia, only about half the time will the other twin develop schizophrenia as well, which shows you there's ample room for environmental factors like marijuana to make the difference between leading a normal life or not. So, No one is destined to become schizophrenic just because of their genes, as many of the marijuana advocates would like you to believe. There's a particular aspect of this issue that it's really important because schizophrenics carry with them the stigma, their whole entirety of their lives really, that they are more likely to be violent. This really harms their social interactions. And there was a landmark study published in 2009 that actually looked at this issue, and what they found was that the vast majority of violent episodes involving people who are psychotic involve those who are also using recreational drugs. They found that, in fact, those who are not drug users, who are schizophrenic patients, are barely more likely than the average person to be violent, just 20% more likely. But those who use drugs are 9 times more likely to commit extreme acts of violence, and that includes marijuana. The risk specific to marijuana is about 18-fold, which is huge. And then the final study, a more recent study, showed where they were just looking at first onset psychosis patients. The violent serious aggression was driven in this study only by marijuana use. You might ask, is it just those with a psychiatric diagnosis of psychosis that, are more violent if they use marijuana? The answer is no. This is a study out of Italy, all psychiatric diagnoses. And then I want to point out a few of the recent high-profile cases involving crimes committed by psychotic marijuana users. Eddie Ruth is front and center. He was the defendant in the American Sniper trial, diagnosed with schizophrenia, or cannabis-induced psychosis, I should say, by 2 experts for the prosecution. And Eddie Ruth told investigators as he was being, that as he was being taken to the gun range by, decorated war hero Chris Kyle and his buddy Chad Littlefield, also an honorable war veteran, that, he perceived that they were hostile towards him. I want you to remember that perception because it's going to come up later in the talk. He became paranoid that they were going to shoot him, so he shot them first. The next case is Darian Aguilar. He was a Columbia Mall shooter in 2014, very close to my home. Shot 2 people, wanted to kill more. Young man, 19 years old, and he, basically, is fresh out of high school. His friends maintained that, he's the least likely person to commit something like this. But in his journal, the police found evidence. Like this state, they don't test for marijuana and suicides. But in his journal, the police found evidence of his marijuana use, and also his visit to his family physician confirmed that he was hearing voices. So clearly something had changed in him to turn him into a violent individual. I'll skip on down to Kevin Darden. He was the subway pusher, pushed an innocent man to his death in front of a subway train in New York City for no reason. And the only encounters that Kevin Darden had had with the law were for marijuana possession. Here's an Oklahoma man who became convinced that his grandson was possessed. He shot him to death, and marijuana was found in his possession. I'll skip on, Joseph Aldridge, the Missouri shooter, killed 7 members of his family for no apparent reason. His neighbors maintained that he'd been acting strangely lately, and they did test in Missouri. He did test positive for just marijuana. Skipping on down to Abdul Aziz, the military recruitment shooter. Certainly he was of foreign descent and he was of Islamic faith, but his friend said, no real terrorist instincts. He was just a pothead. And his family maintained that his rampage was attributable to his bipolar disorder, which is also triggered by marijuana and can also involve psychosis. And then finally, the name that you are all too familiar with here in Arizona, Jared Loughner, who is diagnosed as schizophrenic now and whose behavior began to spiral downward in his late teens with heavy marijuana use. He certainly has gone on to other drugs or had gone on before the event, but as I pointed out in that large Finnish study, it is marijuana that is most likely the culprit for his schizophrenia. Also, violence towards themselves has increased. I mean, you heard, the tragic suicides this morning, a 5 to 10-fold increase in risk, and this is after a prior history of depression is corrected for, after you've taken out, those kids who were depressed before they started using pot. The data from Colorado actually back this up now. 2014, they experienced more suicides per unit population than ever before in the state history. Now you might ask, are there traits that are increased by marijuana, in someone who's otherwise normal, is not psychotic, but may relate to violence and criminal behavior? And indeed, there are studies showing an increase in intimate partner violence, and an increase also, here it says the substances yielding the largest effect were cannabis and hallucinogens in that order. Another study showing even when alcohol is controlled for, an increase in intimate partner violence. Violence in youth in Norway, where they have, a low rate of use, but in those who use, they're much more likely to be violent. Weapons offenses, attempted homicide, reckless endangerment goes up. And this is a study, Lori mentioned, the Aboriginal problem in Australia. In Australia, the Aboriginal preserves have largely managed to become alcohol-free, but they have a problem with cannabis. 70% of the males use. And what they found is that of the users, they are 4 times more likely to enter the clinic there for having been involved in episodes of violence if they are using cannabis. Now, it's dissecting those traits towards, impulsive criminal behavior a little more, what underlies that. There's certainly an increase in the neuropsychological trait impulsivity, and risk-taking, and in this regard, it's not that different from alcohol. Alcohol does this as well. But here's where the difference comes out. Marijuana is associated with increased perception of hostile behavior. Alcohol does to a certain extent, but to a lesser extent, and perceptions of hostility in others. This is where they differ. Alcohol decreases the perception of hostility in others. Marijuana increases it. So remember Eddie Ruth. That's exactly what happened to him. But this is in people who are not psychotic. Is there any evidence that this is having impact on crime? Yes, Denver crime is up. This is data kindly provided to me by the Denver Police Department, and they feel confident that this is not a result of changing in policing policies or categorization of crime. Crimes against persons are up 29%. This was January to August data for this year, which is all that's available. Average with January to August data since legalization in 2013 and compared to the same month period 3 years prior. Here's just a plot of all those crimes. You can see the ones that went up. You can see in 2013, a dramatic rise. 2014 was the year that they legalized the storefronts to open, and there were some crimes that lagged in their increase and waited till 2014 to start going up. This is a summary of them. I want to quickly focus on drugs and narcotic violations. This is something that legalization of marijuana was supposed to help with. It was supposed to reduce the burden of policing, for drugs. Instead, it's gone up 48%. Simple assault up 49%, weapons law violations up 67%. That's not good. Violation of restraining order, that can be very serious, 97%. Intimidation, this generally occurs in conjunction with another crime. It involves serious threat of bodily harm. And then the last, which increased so dramatically, disorderly conduct up 1,139%. You could say, well, those are kind of nuisance crimes. But, this to me is, it's sort of an indication that civil behavior is decreasing in Denver. The other crimes either rose just slightly or fell. The most dramatic decrease was in non-forcible sex offenses, down about 50% or more. And then the other crimes here, I've summarized them. Murder was up modestly, 12%, but for the 12%, you know, the people who were involved, that was important. Aggravated assault up 8%, kidnapping, abduction up 7%. This is all superimposed on national crime rates that are decreasing. These are FBI statistics for the half year, so I can compare it more directly to the data we have for Colorado now for 2015. Violent crime and property crime decreasing nationally. Here, specific to murder, the FBI statistics for murder, superimposing the Denver plot on that for a period of years. There's more variation in the Denver data because it's smaller. That's just a statistical fact. You're going to get more variation with smaller populations. And you can see, although murder was going up modestly in Denver, you know, the national rate's going down. For burglary, there was no difference in Denver, you know, after legalization, but neither is it following the steep downward decline in the rest of the country. So Denver's not doing quite as well as the rest of the country. I'd like to point out that Sergeant Jim Gerhardt is going to be speaking later this afternoon and giving, you know, he works in the greater Denver metro area, and so he's going to give his personal professional experiences that I think will be more illuminating than the dry data that I've been presenting here. And I'd like to finish with one last slide on crime because it has some personal impact. I visited this part of the world, Humboldt County in Northern California, very high murder rate. But I visited it back when it wasn't like that. You know, when I was just out of college, I thought, oh, this is the most beautiful place on earth. And since that time, it has become the single largest marijuana grow area in the country, and they've become a nexus for crime. The locals have a hill there, and they named Murder Mountain. My son decided spontaneously to take a road trip there this summer without telling me. He and his buddy were out hiking in the Tetons, and they decided, oh, they wanted to go Pacific, you know, to the Pacific and do some body surfing. And so they got there, and they were in Eureka, and they had some interesting experiences. First of all, they noticed a lot of youth, their age, you know, young 20s, late teens, panhandling, you know, just homeless panhandling on the street corners. And they were holding up signs that said, anything green will do, meaning money or pot. And then they started chatting with this fisherman on the beach where they were body surfing. And the guy decided, you know, gosh, these kids are from out of state, they don't know, they like to hike. And he warned them, don't go hiking in the coastal mountain range, you're liable to get shot. And then the final straw was while they were there was this horrific double homicide. This young man decided he, for no apparent reason, he stabbed 2 members of his family to death. And when the deputies arrived to process the crime, he persisted in smoking marijuana in their presence, and they asked why. And he said, well, I've been smoking every day since I was 13. I'm not about to stop now. So I'd like to finish with a parting thought. You know, first, one more thing about the crime in terms of the non-psychotic crime. Certainly, marijuana-induced psychosis, there's absolutely no doubt it is involved in violent crimes, no doubt. The other crimes, you know, where the individual is not overtly psychotic, I think, you know, is an area that is worth, you know, our full attention. It really is something that deserves to be studied. But I'd like to finish with a parting thought. The marijuana proponents like to make the comparison with alcohol. You know, alcohol, they say, is more dangerous, and indeed, in the acute setting, you know, you can consume too much alcohol and die. Marijuana is not like that. There are some rare instances of sudden cardiac death. That's serious because it happens in young people. And then, of course, the tragic suicides that can happen fairly quickly. But apart from that, I think the most important question to ask is, can this drug be used responsibly? And that's the comparison that should be made. You can drink socially, lightly, you know, a glass or 2 of wine on the weekend. But is it possible at that rate of use to use marijuana safely? to have a joint or two on the weekend? And the answer is no, because that is precisely when the risk for psychosis begins to rise dramatically. So thank you very much for your attention, and thank you to Mary Lee.